Welcome once more to this YouTube channel. Kindly subscribe to this channel. The subject area we are considering now is applied gross anatomy. We want to see the structure of the human body in health, and also as it assists us when we're looking at diagnosis of certain disease conditions, and also treatments like in surgical procedures. So applied gross anatomy, we are looking at the course outline. What are the objectives? Students that are studying applied gross anatomy need to gain a better appreciation of the structural and functional relationships in the human body in health, and they need to apply this knowledge to understand changes that occur in disease. They also need to appreciate the clinically relevant surface anatomical landmarks of the human body. Right here you can see an illustration of surface anatomical landmarks of the human body. These surface landmarks help us to locate deeper structures in the body, and this is very important when you're carrying out clinical examination of a patient in diagnosis and also in treatment like surgical procedures. It will help you to locate deep structures when you're carrying out surgery. What are the outcomes, the level of knowledge these students need to have at the end of the study of gross applied anatomy? They need to be able to explain at the end the clinically relevant anatomy of the various regions of the body. They should be able to define and palpate clinically relevant surface anatomical landmarks. And they need to apply this anatomical knowledge to explain common clinical symptoms. And the students should also be able to describe the pathogenesis of common diseases using anatomical knowledge. Also, these students should be able to label clinically relevant structures on common medical images such as X-rays. Right here is an illustration of the chest X-ray. You can see the various structures there. You can see the ribs, the clavicle, and then the heart. You can see the heart. The lungs there are seen as radiolucent structures. So the chest X-ray is a medical image that is very important, and students that are studying applied gross anatomy should be able to look at the images, medical images such as the chest X-ray, and then they should be able to label and localize the anatomical structures there. What are the specific topics these students need to be taught? 1. Applied gross anatomy of the upper limb. They need to revise the bones, the joints, muscles, vessels, the lymphatics, and the nerves. They need to also revise the anatomy of the hand, the forearm, arm, shoulder, pectoral girdle, breast, the axillary and scapular regions. The students should be taught the anatomy of extensile exposures of the bones and joints of the upper limb. When you are carrying out surgery on the upper limb region, how are the bones exposed? How do you locate the joint spaces if you are carrying out joint surgery, for example? With the knowledge of applied gross anatomy, you will not have any issues. The students also will be taught the anatomy related to surgical management of breast cancer. How does breast cancer spread? Via the lymphatics. They really need to appreciate the lymphatics of the upper limb to understand how breast cancer spreads. So it aids us in the diagnosis and also in the treatment of breast cancer, because you need to know how it spreads for you to be able to manage it. Students also will learn the anatomy of brachial plexus injuries and its clinical signs, the anatomy of rotator cuff injuries, the anatomy of entrapment neuropathies. The second topic is applied gross anatomy of lower limb. Students will revise the bones, the joints, muscles, blood vessels, lymphatics, and the nerves. They will also revise the foot, lower leg, the thigh, and the gluteal region. And of course, the students need to be taught the anatomy of surgical approaches to the hip joint, knee joint, and then ankle joint. When the orthopedic surgeons are doing some surgery on the knee joint, the ankle joint, and the hip joint, the anatomists are right there to aid in localizing the joint spaces. So it's very knowledge of applied gross anatomy of the lower limb comes in here. The candidate also will be taught the vascular anastomosis of the lower limb in trauma and atherosclerosis. The anatomy of the lower limb as it relates to external fixation. When you are managing fractures, you need a good knowledge of applied gross anatomy of the lower limb if you have to manage fractures of the lower limb. The anatomy of knee injuries also will be taught. Very common among the sportsmen and sportswomen, you have knee injuries, even among all of us. So for you to be able to, the surgeon needs to manage the knee injuries, and he needs a good knowledge of applied gross anatomy of the lower limb. Next topic is applied gross anatomy of the head and neck. Candidates should revise the scalp, skull, cerebrum, cerebellum, midbrain, brainstem, and cranial nerves. Of course, face, eyes, ears, nose, mouth, pharynx, larynx, neck. Then the candidates should be taught anatomy related to skull fractures and complications, anatomy of cerebral circulation, anatomy of facial fractures and complications, anatomy of the larynx as it relates to deglutition, that's swallowing, respiration and intubation in anesthesia. Then anatomy of the movements of the neck, anatomy as it relates to cervical spine injuries, anatomy of lymphatic drainage of head and neck malignancies. You really need a good knowledge of anatomy. You need to understand the lymphatics of the head and neck for you to understand why the malignancies, cancer of the head and neck region can spread and even spread to all parts of the body. Next topic is applied gross anatomy of the back. You need revision of vertebral column, the spinal cord and nerves, and of course the candidates must be taught anatomy of traumatic paraplegia. They need the clinical relevant surface anatomical landmarks of the body. They need to study these landmarks for them to appreciate the deeper structures in the body, very important in surgery. They also need to be taught the clinically relevant structures on common medical radiographs of the back, like the X-ray. Next topic is applied gross anatomy of thorax, a review of the chest wall, ribs, diaphragm, airways and lungs, heart and great vessels, mediastinum, anatomy of thoracic surgical approaches. You need to appreciate what the cardiothoracic surgeons do. So they need a good knowledge of anatomy. Anatomy of congenital malformations. How do congenital malformations that you find in the thoracic region, how do they come up? You have to understand that. The circulatory anatomy of the heart and lungs related to bypass surgery. So a good knowledge of applied gross anatomy of the thorax is important if you are to understand what bypass surgery is all about. Students also will be taught the clinically relevant surface anatomical landmarks of the thorax, and then clinically relevant structures on common medical radiographs of the, not just radiographs, medical images of the thorax. The common ones are the radiographs, that's the chest X-ray. Next topic is applied gross anatomy of the abdomen, abdominal wall and peritoneum, liver, spleen, intestines, pancreas, kidneys and ureters, aorta and blood vessels, the other blood vessels, anatomy of inguinal ligament, inguinal hernia, and hernia repair. You need a good knowledge of applied gross anatomy of the abdomen for you to understand what is inguinal hernia, the direct and indirect, and how management is done. The candidates also should be taught the clinically relevant surface anatomical landmarks of the abdomen and also structures that you see on common medical images of the abdomen. Next topic here is the applied gross anatomy of the pelvis and perineum. You need a review of the bones, joints, muscles, nerves, vessels. Also the urinary and reproductive organs should be taught. Congenital malformations also. Congenital malformations that you find in the pelvis and perineum can only be appreciated with a good knowledge of applied gross anatomy of the pelvis and perineum. The students also should be taught the clinically relevant surface anatomical landmarks of the pelvis and perineum, and then clinically relevant structures on common medical images of the pelvis and perineum. Talking about the congenital malformations that you find in the pelvis, you have here an illustration of the uterine congenital malformations. Recall that in formation of the uterus, the middle part of the right and left paramesonephric ducts unite to form the uterus. So if this does not occur properly, you have uterine congenital anomalies like the bicornate uterus, unicornate uterus, septate uterus, T-shaped uterus. All these are illustrated right here. The males also are not left out. You could have cryptorchidism, that's undescended testis. During descent of the testis, recall that the testis moves from the abdominal region to the inguinal region and finally to the suprascrotal position. So when this does not occur properly, you could have an ectopic testis in the wrong position. So it could be prepenile, it could be superficial, in a superficial ectopic position, it could be in the transverse scrotal position, it could be in the femoral position or perineal position. So these are congenital anomalies that you could have in the pelvis and perineum region. Look out for other videos on this channel for details of all these topics. Don't forget to subscribe to this channel. Thank you for listening. Goodbye for now.